Hello and welcome everyone to this session on ECG, and we are going to call it as ECG Part 1. This is going to be a multiple series session in which I'm going to focus on the very basics of ECG, how to identify abnormal and normal ECGs, how to calculate the rate, rhythm, axis, all of those things that you all should have learned in final MBBS. Now, what happens is in final MBBS, we have so much to do. We have medicine, we have surgery, we have pediatrics, OBGY, and out in all of this, we hardly get time to focus on something called as the ECG. Now, for final MBBS, it's still okay. But as you go to your residency and you're expected to decode ECGs in the PAC, OPD, ऐसे झट पट पट करके, at that time you'll realize that if you don't know your basics, then you are going to have a hard time decoding the ECG, 12-lead ECG in the PAC, as well as the 3 and the 5-lead ECG that you see during the monitoring of the patient intraoperatively. So, your seniors will come to your rescue then. They'll teach you a little bit phat 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 karke. They'll give you a half-an-hour rapid session on ECG, which over a period of time will not help you in life. And what you will be left with doing is asking for physician reference every time so that someone else reads something as basic as the ECG and gives you. So in these series, even though we have covered ECG before, there we have mainly seen the abnormal ECGs, and here I'm going to focus on the very basics from the beginning of how does ECG happen, how is it recorded, what is the rate, rhythm, all of those things. All right. So without wasting further time, let's start off with our part 1 of ECG. First of all, what is electrocardiogram? Electrocardiogram is nothing but it is a piece of paper which is recording the electrical activity of the heart. Okay, so the question comes, where does this electrical activity of the heart occur? So this electrical activity of the heart comes from the conducting system of the heart. Okay, so let's have a quick look at the conducting system of the heart. I'm sure this is like the most basic thing, but many of you all would have forgotten this. So I'm just going to quickly touch up upon this. When you look at the right atrium of the heart, there is something called as the SA node. Where is the SA node located? If you see, the SVC comes from here and the IVC comes from below, and they both drain into the right atrium. Now, where the SVC joins the right atrium, just there at the joining, there is the positioning of the SA node. Now, this SA node is also called as the pacemaker of the cell, and it is the beginning of the conducting system of our heart. Whenever the SA node fires an impulse, it basically fires nothing but an electrical impulse. Okay, now this electrical impulse, it travels in all directions in the atria. How does it look like? Now, if you've taken a stone ever and thrown it in a pond, okay, so imagine you're throwing a stone in a pond, it creates ripples like this. Okay, so similarly, the SA node also, when it gives out the electrical impulse, it creates some ripples which spread along the entire right atrium, goes to the interatrial septum, and also spreads to the left atrium. Okay. Now, as we know that there is also something at the base of the interatrial septum, and that is called as the AV node, the atrioventricular node. Okay. This atrioventricular node is also a part of the specialized conducting system of the heart that we are talking about. So, SA node is the first part, AV node is the second part of this conducting system. All right. So, let's have a look at what happens when the electrical impulse spreads in both the atria. When the electrical impulse spreads in both the atrium, it makes the myocardial cells contract. Okay, so the right atrium and the left atrium both contract. Now, when this impulse spreads over to the AV node, then what happens? So, when this impulse spreads over to the AV node, then this impulse goes to the next part of the conducting system, that is the bundle of His. Okay, where is the bundle of His located? The bundle of His is now located at the top of the interventricular septum. All right. Now, the bundle of His is the third important part of the conducting system of the heart. This bundle of His gives off two branches. The one that goes to the left side is called as the left bundle branch. This left bundle branch will go and divide into two parts. It will divide into an anterior fascicle and a posterior fascicle. Okay, we'll worry about this later, but this is the basic on the left side. On the right side, the bundle of His gives out the other bundle, that is the right bundle branch. Okay. Now, these bundle branches that are present, as the impulse spreads through these bundle branches, they depolarize the entire ventricle. They activate the entire ventricle and the ventricles start contracting. Okay. If you look at the bundle branches also give out some fibers which lead in fast activation of the ventricles. And these fibers are called as nothing but the Purkinje fibers. Okay. So the Purkinje fibers, bundle branches, and the Purkinje fibers. These are all part of the conducting system of the heart. Now you will say, ma'am, what is so special about this conducting system of the heart? Is there something special in them as compared to the normal myocardial cells? Why can't this impulse go through the normal myocardial cells? So, yes, there is a reason for this. If you look at the normal myocardial cells, these are how they are. Okay. If you look at the cells in the specialized conducting system, they are joined together by something called as gap junctions. They are joined by gap junctions. Okay. So what is the use of these gap junctions? How are these gap junctions useful? The transmission of impulse through these gap junctions happens very, very quickly. Okay. If the impulse has to travel from one normal myocardial cell to another normal myocardial cell, suppose it has to spread from here to here, then it will take some amount of time. However, if it has to spread in the specialized conducting tissue through the gap junctions, this happens very, very quickly. So as a result of this, the impulse spreads quickly from SA node to AV node to bundle of His to right and left bundle branch block and then to the Purkinje fibers. All right. So this is the electrical conducting system of the heart. Now, one very small point to note over here is that when the impulse spreads from SA node to AV node, in the AV node, the impulse is slowed down slightly. Okay. So this is called as the refractory period. That the impulse is slowed down slightly by the AV node and then passed on to the bundle of His. Why does this happen? Because the AV node has lesser gap junctions as compared to the rest of the tissue. All right. But again, this is a very complicated concept. But just remember, AV node will slow down the impulse from passing. All right. Okay. So this is about the electrical conducting system of the heart. And now